You're listening to the official OSAP podcast with Michelle Lee, bringing you infection control tips and information to make you a safer practicing clinician. And now, here's your host, Michelle Lee.
Hello, and welcome to OSAP's podcast. I'm Michelle Lee, your host, and I have a fantastic opportunity for all of you today to meet someone that I've enjoyed working with during my time at OSAP. We have as our guest, Greg Holder. Greg Holder is a policy analyst at the CDC Division of Oral Health, where he analyzes state and local legislation and other health policy to determine its impact on oral health, the use of infection control guidelines, and responds to public inquiries. Welcome, Greg.
Pleasure to be here.
Thank you. Well, I will tell you, we have Greg here for not just because I wanted to hang out and talk with him a little bit, but we have a reason. CDC, you have a new training opportunity for all oral healthcare professionals. Tell us a little bit about that, Greg.
I would love to. So this is a long story. As everybody knows, CDC Division of Oral Health, we do guidelines and resources for infection control in dental settings. And the main guideline is the Guideline for Infection Control in Dental Healthcare Settings, 2003. Around 2016, we turned that into the summary document, the Summary of Infection Prevention Practices in Dental Settings, Basic Expectations for Safe Care, which is a user-friendly just summary of key recommendations for dental healthcare personnel. And so one of those recommendations is that every office has an infection prevention coordinator. Well, we know that in a lot of these offices that is a voluntold position a lot of times, and
Yes.
the person that is maybe in that role they may be comfortable with material, but they may not be comfortable with sharing that material with others to do the training for everybody else in the office. And so we worked with that material to turn it into the Basic Expectations for Safe Care training modules, which is a suite of 10 module trainings with both slides and presenter scripts about basically mirroring the summary of let's call it summary from now on. We know that what that is. And so those were designed to just like hand package. Here are slides. Here's what you need to say. Break it up however you want. You can take 20 minutes during a staff meeting, get your training out of the way. It's a very popular resource. It's got tons of downloads in the PDF versions of it. The gap, though, is that we realized that there was not a training, like a credit providing training. And that's really what a lot of people want, because in many states, dental assistants, certain dental hygienists, dentists, all are required to get CEUs, continuing education credits, or continuing dental education. And there wasn't a training out there that was at the federal level that was free, that provided these credit opportunities. And so I wonder if we can take these best training modules and turn them into a online self-paced training. We had done a training at Division of Oral Health in another subject area called, in the water fluoridation, is called Fluoridation Learning Online. And so we took that infrastructure and we put the content from the BESC and fleshed it out with additional information from our website, from other guidance documents that CDC has that are applicable to the dental settings, some updates that had happened, after the summary was written, and basically put it all in there and turned it into foundations, building the safest dental visit. And that was.
Let me stop right there.
Sure.
I love that title. The safest dental visit.
That's right. And that's there's a reason that we picked that. We identified really early on. So CDC provides a number of different opportunities for CEUs in various fields. They have them for nurses and doctors and even veterinarians, and just general infection control credits, actually, that are here's a CDC CEU for whatever that's worth to you. But we knew that we didn't do dental. That's actually it's a pretty niche thing. We're basically the only group at CDC that really has a role, and we've never really had a chance to run through that. But we were like, hang on, we knew an organization that we work with a lot that does. And so we identified OSAP early on as a partner, a potential partner for this. And was actually one of the first questions that we asked. I mean, the first one was, hey, would you want to be involved and give CEUs? And they were like,
Yes.
yeah. Michelle was like, absolutely. And then we were kicking around names for this training, and the imagery of a house really sort of really spoke to us. You have your foundational level understanding of infection control, things that are just sort of like, what are the guidelines? What are the recommended recommendations and resources? What are the things that you use to evaluate a program in an office? And that's sort of your foundation. And then you have like your middle section, like the walls, which is what you do to protect yourself and protect your patients, right? The things like sterilization, standard precautions, not sterilization, standard precautions, respiratory hygiene, cough etiquette, things that are safe injection practices. And that's the sort of like, that's what keeps you safe. And those are the walls, right? And then to top it all off is the roof, which is the sterilization. It's environmental infection control. It is dental unit waterline safety. And so we use that imagery of a house. So what about foundations? It's a name. And we appended building the safest dental visit because that's OSAP's tagline. And we're like, well, we're working together. Let's do it.
Yes,
right.
I
And
love
so,
it.
yeah, Foundations Building the Safest Dental Visit is the name of the training. We anticipate that it is going to be released in middle of September.
It probably will be released before this podcast airs, actually.
That's a good point. Yeah.
Because we record ahead of time. Yes.
That's right. So by the time you hear this is old news to everybody, because we'll have done such a great job at telling everybody about it. So Foundations is really cool. So it's broken up into 3 modules instead of the 10 module training that we have with BESC. It's broken up into those 3 areas I talked about. So you have the foundations, which is just sort of an overview of what infection control is. It talks about the various guidelines, resources, recommendations that are out in the world that matter to dental settings. And if you've listened to my boot camp, plug for boot camp, my presentation that I did for the virtual boot camp, that's actually what that presentation was based off of, was that middle section. And then about program evaluation is that 3rd section. The protecting patients, protecting yourself is the middle module, and that is hand hygiene, personal protective equipment, respiratory hygiene, cough etiquette, sharp safety, safe injection practices. And then the final module is the sterilization. And we actually broke that up into the sterilization, just sort of an introduction, talk about semi-critical items, critical items, single-use items. How are the little, how do you define a single-use item? And then there's a section on the process of sterilization. And then there's a whole section on sterilization monitoring. There is a section on environmental infection control and then dental unit waterline safety. And so when we anticipate this training so I should say, the modules probably can be taken probably about an hour a piece. This training is designed so that you can leave the training and come back, start whenever you need to, so you don't have to take it all at one time. You don't even have to finish them out. You could take 3 slides out of a lesson if that's all you have time for. But when you get done with all 3 modules, you'll take a test at the end to prove that you picked up the knowledge, and then that's where OSAP steps in. Yes. And so, Michelle, tell me about OSAP's role in the Foundations training.
Turning this around,
That's right.
Yes. No, there will be a link after the test has been completed that will take you to OSAP's digital educational learning site, which is also a brand new tool that we have. It's our Infection Prevention and Safety CE Center. And you will be able to complete a short evaluation on Foundations, and then we will issue you the certificate with your CE hours. So it's a great partnership and great opportunity for us to support CDC. And because we do believe in this tool and are so excited that you've put all of the time into developing this, because this has been quite the journey to get this developed, hasn't it?
It has been, yeah. Yes. This started last year. The initiative started last year around the time where we were developing it was right during the middle of the beginning of the COVID pandemic. Actually, was the not the impetus, but like we said, well, this is something that we probably could work on. People are more interested now than ever in infection control, and so they need this sort of training. And then it took over, and so it started. We worked on it all last year, and then picked it up again this past year to try to get over the finish line. And so we're super excited. This is a labor of love for us. It's going to be, we hope, going to be used so much. We were doing some other work in the policy field and found that Bureau of Labor Statistics from the Department of Labor estimates probably around 1 million dental professionals. And by dental professionals, that's dentists, hygienists, assistants, anybody that's like a laboratorian that works in making prosthodontics, or and that includes the office workers too, because those people, if you go look at the definition of healthcare provider, those are all considered dental healthcare personnel. And BLS, they, as I said, they estimate around 1 million people. It was about 969,000 in 2019 estimate. So we're 2 years past that.
Wow.
So potentially a huge audience for this, and it can be. It's designed. The intended audience for this, again, the dental healthcare personnel writ large, the infection prevention coordinator. This is a good way to train them to so that they know what's there and know what they need to convey to their staff. Dental educators, as part, and this is a great if you're a dental assisting instructor, hygiene instructor, dental student. Give it as class credit. Here's some homework for you. Take this training, and there you go. Now CDC is doing the teaching for you. Dental consultants, our lovely dental consultant friends that we have out there that go into offices all the time, talk to people. Hey, here's an opportunity for you to pass this training on to the people you're talking to, or if you just want to brush up yourself and see what CDC says about it. And then just one of the things that I've been trying to work on here is the idea that the members of the public should also be very interested in infection control of the dental settings. It's not something people think about. We've been told, after all, we've been told all our entire lives, when they stick the little or close, sorry for the sound effect, everybody. But you're not supposed to do that, right? And so like those things.
Well, let me describe to people what you've just done.
Right.
You just put the suction in to rinse, yes, and
the saliva ejectors now.
Yes, yeah. And he was explaining that you should not. That's right. When they tell you to close down, you should not close down, and they shouldn't be telling you to close down.
And that's very true. And actually, it's funny because I go to the dentist myself. I'm not a dentist. I'm not a hygienist or an assistant. I actually came into this field from a whole different aspect, but I've always been to the dentist. And even now, my dentist, who I love and who does good infection control, I continue to have to educate them. Don't do that because of backflow issues. But just like when someone walks into the office and sits down in the chair and they walk in and like the tray's ready, all laid out already underneath a towel. Well, that's not what CDC says to do, right? And so if people pay more attention to that and the public pays more attention to that, it's going to make everybody safer because it's just a positive feedback loop. They see that infection control is important to their office. The office sees it's an infection control is important to the patient, which means they're more likely to do it or allocate the resources or the time to do it properly.
Well, and and I think we all agree that in the past 18 months, people have been patients have been more educated on infection control than ever before, right? So, I think before March of 2020, the average American did not know what PPE stood for.
That's exactly right.
And now they do. So we as dental healthcare professionals, we need to be providing, educating our patients on what we're doing to keep them safe. And again, I think it's a great marketing opportunity for a practice to be able to educate them and say, this is why we're opening this package in front of you so that you know that we didn't just pull these instruments out of a drawer.
That's exactly right. Yeah. And that's actually one of the, I don't love having medical or dental procedures necessarily, but like I do love being explained like this is what I'm doing and why, so that I'm a smart guy. I can follow along in my head what's going on. It's really important for
Right.
patient education. You're exactly right. And with so with the amount of emails I got from my dental provider about we're following the CDC guidance, we are doing X, Y, Z over the from the last year and a half. I mean, you're right. It's made people pay much more attention to that it's even a thing,
Yes.
and that like I said, it's a great marketing opportunity. You're right.
Absolutely. So, I love everything about foundations, and one of the things I love is that I n- I don't know that it was intentional, but the timing of this was great that it came out during September and Dental Infection Control Awareness Month, right?
That's right.
What a great thing for us to get to highlight this month as we celebrate all that's been done to keep patients and providers safe. All of this work with guidance, and I know how hard all of you work to make sure that we have the latest and we're doing the right things. One of the things I think I can see as a huge benefit of foundations, I get phone calls all the time from dental practices who have hired new staff, and they want to know how can we train, how can we give them something today. I'm of course always going to promote OSAP's Dental Infection Control Boot Camp, which you and many of your colleagues at CDC come and speak and provide amazing information, but they may not be able to wait until January for that. So they want something that they can do now to at least get them going and understanding. And this is going to be an ideal resource for us to refer them to.
Oh, that's a fantastic point too, because it sets a nice baseline. It sets a foundation, if you will,
Yes.
of the of what should be expected of everybody. There's a it's every patient every time, right? Like you should be
Right.
doing this for everybody that comes in there. Some of the ways that we've worked together, actually, I'm going to give a plug to. Speaking of consultants, we work with a couple of wonderful OSAP consultants that did audio case studies for us, basically taking this information that is, I mean, it's CDC information. We made it as engaging as possible, but it always is nice to be able to see how that applies like to you personally. And I was
Yes.
really struck by Tia Hunter, who I hope is listening to this. Her case study that talked about that in dental unit water lines, about that
Mm,
not only is she a consultant and an educator, she works in an office, right? She works there and she's a patient there. Her family is patients there, or are patients there, and that when they were doing the waterline testing, that there was an issue that came up, and it was one of those things of she said I wanted to make sure that we did this right, because I go there and my family goes there and I want them to be safe. And there's a lot of that too. There's where I don't know of many dental offices where where a spouse or a mom or a daughter says, "Don't come here. Y'all don't. You maybe want to go somewhere else." No, we refer to our own people because we care about them, and
yes.
we want to be in a place where they're safe. So,
Mhm.
yeah, the new hire, like that's a wonderful way to use this. Not only just that, but we recommend as part of our infection prevention program recommendations, at least yearly training. Like take it take it early and often, I guess is the but
Yes.
it is a fantastic resource for new hires, for people that have been there a long time that just want a refresher, anybody that's just really interested in this topic.
Yeah, and you just made me think of something. For years, since I think it was, I don't know, 1989 or 1990, OSHA has required dental offices to have an annual update on bloodborne pathogens.
Hmm.
So every year, dental offices know this. They have to have an update, a review. Has anything changed? And a lot of people just think that always includes all of infection control. but that's just bloodborne pathogens. That's just a piece of this. So this is an additional tool to add in. So you're getting the full coverage here.
That's right.
It's about because OSHA talks about keeping employees safe. And this is also talking about keeping employees safe, but also the patient safe.
That's exactly right. That's why we named that second module, protecting patients, protecting yourself, because
yes.
That's half of the battle. It's actually one of the roles of the infection prevention coordinator is to. I'm back. I'm sorry. It looks like I may have hung up a little bit there. Sorry about that.
We can fix that. Okay. So one more point about the infection control coordinator. I want us to really highlight that, because that's something that I still think the last survey that I read, only about 49% of practices had a designated infection control coordinator in their office. It is part of the guidance. It says every office should have an infection control coordinator, right?
Yes, that is correct.
So if your office does not have a designated person as their infection control coordinator, please stop. If you're listening to this podcast or watching this YouTube, I'm sure you are someone that is passionate about infection control. Raise your hand, volunteer, say, I want this role, create the role. And on the OSAP website, we actually have a sample job description of an infection control coordinator. So you can always take that. If you're a dentist listening to this and you think, oh, I don't have that person designated, go to our website, download the job description. We've made it very easy for you to do. And now we have this foundations training that's going to be a great first step. And then they can go on from there with additional training.
Yeah, that's right. They'll have the ability to use the best training after that. Like they will be comfortable enough to train the rest of the staff. They'll take our training. They'll be, wow, that was good stuff. Let me take that same information and be able to give it to everybody else. We make this easy.
Yes. And so why I have you here, let's talk about other resources that you have from Division of Oral Health.
Ooh.
And I know, exactly. We don't have all day. I know that, but there are some amazing, and I don't think everybody understands or is aware of all of it. Like we have on our website, Ask OSAP, where people can enter questions. You have something similar that you actually do a lot of the responding to all of those questions, don't you?
Yeah, that's true. Yeah. So do we have resources? Yes, we do. And so we'll start there. So what Michelle is speaking of is what's called CDC info, which is not just for us. It's if you ever have a question about anything that appeared on any CDC website, if you just have a question about how should I protect myself from tuberculosis or whatever. At the bottom of every CDC webpage, there is says have a question, ask CDC info, and there is a web form you could do. There is a phone number you can talk to a live agent. Actually, we provide. There are questions that tend to come in often enough, or that are standard enough that we can actually provide them the information right there, and they can answer your question right on the phone. And they know, those agents know our website inside and out as well. And a lot of times they can answer those questions. It's great for, speaking of COVID, it's a great one for COVID. They have access to the COVID-19 response, all their information. If there's questions about vaccinations, by the way, go get your vaccine. That is a CDC recommendation, I'm proud to say. If you have a question but if you have a question specific to this content, it will come to our division, and they will send it literally. And I'm on the other end right now of that inbox. So if you ever ask a question, I'm on the other end helping write that response for you. And we're always happy to help you interpret a situation, help you locate where something is in the guidance. The guidance document was. It's a guidance document. It's 40 something pages long, and it's pretty dry, and it's hard to find stuff sometimes. I know, because I have to do that to answer these questions. But I'm always happy to pull the relevant information so that you have it there ready to go. So that's a fantastic resource. There are some other resources. Can I talk about them?
Yes, please.
All right. She's just going to let me go. She's made a mistake, guys. All right. So So first of all, there is one of my favorite things is this is a nerd thing. I apologize for saying my favorite thing here. The CDC Guidance and Guidelines Library. And that is a website it's on the main CDC site and the infection control section. It's hosted out of our sister division, which is Division of Healthcare Quality Promotion. And if you've been to the OSAP boot camp, my colleague Ryan Fagan, he speaks there. They're a fantastic group. We work with closely, and that document is where all of the guidance documents from CDC infection control sit. The 2007 isolation precautions, the 2003 environmental, the 2008 Rutala guidelines, or the sterilization guidelines. That's where there's a link to our guidance on there as well. The core practices document is it. That is the mother lode of all the CDC guidance documents. It's a great resource if you ever just want to get down into the weeds about it. So clearly we have a website. We have a pretty robust website. You can that we have a FAQ section where these are questions that we've gotten before literally over the last 20 years, and we sort of archive them and we keep them up to date. And as we get new questions that come in, we update the website with those as well, so that if you ever have a question and you don't see it answered like on a web page, go take a look through the FAQs. It's probably been answered before. And if it's not, again, you have CDC info, right? So there's the website there. On our website, you also can find an HTML or a web-based version of the summary of infection prevention practices in dental settings. You see it as the green book. So there's an HTML version for that, and what we would call a digital first initiative, basically taking that and making it available on your smartphone or a tablet. We recognize that it's hard to download a PDF and look at it on your phone, and a lot of people like to carry around the green book, but this is a lasting resource. But if you like the green book, you actually can order copies of the green book, yes. The summary on our website. If you click on the summary page, our website, by the way, I should say, is https://www.cdc.gov/oral health. And that takes you to our main page, and this is all in the infection control section. And so if you click on the summary, at the very bottom, you will see the instructions for ordering up to 5 physical copies of the book. People use those for handing out, consultants like to hand them off at offices as well. If you need more than 5, send us an email and we can try to work with you. As part of that document, there is an infection prevention checklist, which was originally printed in a very similar green thing. Now it's a PDF version on that same website. We have a plain PDF version, and we also have a fillable form. So we took the PDF and made it so that you could open it up on a tablet or a computer, laptop, type the answers in, and so you can keep that for your record. So that's a great resource if you are an infection control coordinator and want to keep those records and do these ongoing direct observations and assess your program once a year, as we recommend. Recognizing that people use phones, we took that checklist and turned it into the Dental Check mobile app. And so that is an app-based version of this checklist. It's available in both Android and Apple devices. It's available in the app stores, the respective app stores, CDC Dental Check, one word. And literally, it's just a web-based version of that. You save those as PDFs as well. And so you have those copies of those records that you do, that email them to yourself. That one's pretty cool too, because we have linked it to the summary and to the other resources as well. So if you have a question and you click on the correct spot, it'll take you to the reasoning behind the checkbox as well. The why.
Yes.
And so we love that. That's available also in Spanish as well. And so that's actually, the summary is also available as a checklist, is also available in Spanish, and now the app is too. That's fairly recent. Oh, let's see, what am I forgetting? So the best training modules, I should point. I should look at our website. I know I'm going to forget something. Y'all don't see on the audio only. You don't see me frantically looking at our website. We have so much stuff that it's impossible to remember it all.
It's
so that
amazing.
really.
Yeah. I mean, that's one of the things that OSAP what we love about working with Division of Oral Health is helping to let people know that you have all of these resources. So so Greg, you've participated in our boot camp and, sharing the resources that are available, and we appreciate that. And when we are able to meet live, which we do hope we're able to meet live in January of 2020, Greg will usually have some of those copies of the summary that he can provide to you as well.
Yeah, always love coming to boot camp, and we've had a table there for I don't know how long, and
Yes.
me and my colleague Cassie, we have resources. We have our other resources too, because Division of Oral Health does more than just infection control. We do.
Absolutely.
I mentioned water fluoridation earlier. We're the oral health people at CDC.
That's right.
It's in the name. And so on our website as well, just so everybody knows, there, if you ever need to talk to a patient about why oral health is important, about how it impacts your health overall, just any information, we have it on our website as well on the general pages. Feel free, and there's also some the fast facts section, which is just basically bullet points of the most up-to-date information about our epidemiology of oral diseases and what you can do to improve oral health overall.
Wow. Well, Greg, thank you so much for taking time out of your very busy day, because I know every day is busy for you these crazy times.
That's
Got
a training to put on.
Yeah, right. Yes. But so thank you for taking time, and I'm real excited about this. OSAP really appreciates the opportunity to work with you all on this, and I can't wait to go through it myself. I think it's just going to be a blast, and we do appreciate the OSAP folks that helped out with the case studies for that program as well. So thank you, and if for our listeners out there, we have, it's time to register for our annual dental infection control boot camp that will be held in January in Atlanta. You can get information on the dates, all of that, by going to osap.org under our education and events, and you will find the registration information. We are offering it 2 ways this year. This is new. We're going to, fingers crossed, have a very safe live event. And then that event will be recorded. It's a full course. It's a full 3-day course. So we will record the whole event, and we will be, you can register to participate online on demand recordings, and you'll have 60 days to access that information. So it's a great opportunity, especially if you're not comfortable traveling at this point. But we wanted to make those options available for everybody. So until next time, thanks for joining, and stay safe. Bye now.